She is the nurse nobody notices, the one who takes the insult, swallows the anger, and keeps moving, because she decided a long time ago that invisible was safer than seen. Then 3 unmarked SUVs block the ER entrance. Armed men pour through the doors carrying someone who has maybe 4 minutes left to live. The attending physician freezes. The room freezes. Her hands stop shaking. In 60 seconds, she does something no nurse is supposed to know how to do. And a 3-star Admiral standing in the corner watches every move in silence, before asking the one question she spent 4 years making sure no one would ever ask. The past doesn't disappear. It just waits. If this story already has you hooked, hit that like button right now. And drop a comment telling me what city or country you're listening from. I want to see exactly how far these stories travel. Don't forget to subscribe and welcome to Silent Badges Stories. You're exactly where you're supposed to be. You're floating today. Doctor. Lowe didn't look up when he said it. That means you follow, not lead. You stalk, you assist, you document. You do not touch my patients without my explicit instruction. Are we clear? Dana held the supply cart with both hands. Clear. Good. He was already walking away. Bay 3 needs a blood draw. Start there. She watched him go. 30 years of medicine. 30 years of treating nurses like furniture that occasionally got in the way. She'd been at Harwick Coastal Medical Center for 4 months. Long enough to learn the rhythms. Long enough to know which doctors were distracted, which residents were in over their heads, which charge nurses looked the other way. Long enough to become invisible. That was the point. The ER smelled like salt air and antiseptic. This close to the waterfront, the ocean crept into everything. The linoleum, the walls, the corners of the ceiling tiles where moisture gathered and turned gray. It was nothing like the hospitals she'd trained in. Nothing like the field stations in Kandahar where the air was pure dust and copper. Good. She didn't want reminders. Dana pushed the cart toward Bay 3. The wheel stuck on a seam in the floor. She adjusted without thinking, a quick wrist pivot. The same motion she'd used on rough terrain with a litter and 200 pounds of operator and gear. Then she caught herself. Slow down. You're a float nurse. Float nurses don't pivot equipment like they're adjusting for elevation. The patient in Bay 3 was 62, diabetic, hypertensive, presenting with chest tightness and shortness of breath. Dana read the intake sheet, then read the patient. His skin had that particular grayish undertone she'd learned to recognize. Not from nursing textbooks, but from the field, from men who were about to cross a line the textbooks didn't cover. Mr. Ellison, she said, pulling on a glove. I'm going to draw some blood. Might pinch for a second. Nurse, he said. I haven't been afraid of needles since 1987. Fair enough. She found the vein without a tourniquet. 3 vials, clean, no second attempt. He watched her hands the whole time. You've done that a few times, he said, once or twice. She labeled the vials without looking. Military? Her hands paused, just for a half second. Then she pressed the cotton swab to his arm and smiled the way she'd practiced. Neutral, professional, no information. I'm just a nurse, Mr. Ellison. He studied her. He had the eyes of a man who'd spent his life reading people. Sure you are. She was back at the cart before he could say anything else. The ER moved through its morning cycle. Triage steady, nothing critical. 2 minor MVAs, an elderly woman with a UTI and a blood pressure that needed watching. A teenager with a dislocated shoulder who cried more than he needed to. Dana rotated through bays, invisible by design, doing exactly what float nurses were expected to do. She did not offer opinions. She did not correct residents. She did not show what her hands were capable of. Dr. Lowe made rounds at 10. He moved through the department like a man who expected rooms to rearrange themselves in his honor. Residents trailed behind him with tablets and expressions of careful neutrality, the particular blankness of people who had learned not to react to anything he said. Martinez, He stopped at Bay 7 without looking at the chart. Walk me through this patient. The resident, a second-year named Sofia Martinez, started her presentation. Clean. Organized. Good instincts. Lowe interrupted her on the second sentence. No. Start over. What's the chief complaint? Chest pain with radiation to the left. The chief complaint is documented. Substernal chest pressure. Onset 2 hours. 4 out of 10. That's better. He turned to the patient, a man in his 40s in a company polo shirt. When did the pain start? The patient answered. Lowe typed something into the tablet without looking at him. Then he turned to the charge nurse. Troponin and BMP, EKG. Get cardiology on the phone, not the fellow, the attending. He turned back to Martinez. You ordered the EKG first? I ordered the EKG and troponin simultaneously. Wrong order. EKG first. Always. He moved to the next bay. Martinez looked at the floor for exactly 2 seconds. Then she looked up. Dana was restocking the crash cart 3 feet away. Their eyes met. Neither of them said anything. There was nothing to say. Dana went back to restocking. She'd worked under men like Lowe before. Not in ERs. In briefing rooms. In command tents. In the kind of environments where rank could get people killed if the wrong person held it. The difference between Lowe and those men was simple. Those men had at least earned the right to be in the room. Lowe had earned the right to be condescending at sea level, in a climate-controlled hospital, where the most dangerous thing that happened on any given Tuesday was a chest pain that turned out to be acid reflux. She pulled a package of 14-gauge angiocatheters from the resupply box. Counted them, noted the expiration dates. Wrote the discrepancy on the inventory sheet in the precise, small handwriting she'd used for mission logs in conditions where fine motor control required effort. Her left hand was steady. It was always steady when she was working. At 11:40, Lowe stopped beside her at the medication station. She was double-checking an antibiotic dose for Bay 9. You're the float from the agency? He said. Yes. Which agency? Coastal Staffing. I've been here 4 months. He looked at her the way people looked at something they couldn't categorize. 4 months as a float? Yes. Most agency nurses rotate. They don't stay. She kept her eyes on the medication log. I like it here. He made a sound that wasn't quite a laugh. He took a cup of coffee from the station and walked away. Bay 6 needs an IV restart. Previous nurse blew the vein. On it. She waited until he turned the corner. Then she set down the pen, pressed both hands flat on the counter, and breathed. 1 breath. Just 1. Then she pushed off and went to Bay 6. The patient there was in her late 70s. Small, white-haired, hands like paper. The previous V site on her left forearm had a bruise blooming under the tape. Classic blown vein. Too much pressure on fragile tissue. Hi, sweetheart. The woman said when Dana walked in. Are you here to stab me again? I'm here to get it right this time. The woman's name was Margaret. She'd been admitted for dehydration. She'd been arguing with the nurses for 3 hours because she wanted to know if her cat had been fed. I called my neighbor, Dana said, putting on fresh gloves. Found your emergency contact in the chart. Figured it was the fastest way to get you to hold still. Dana examined both forearms carefully. The veins were fragile, mapped under skin that had gone translucent with age. She looked at the back of Margaret's right hand. Found one. Thin, but present. This will take about 15 seconds and it won't hurt much. That's what the last one said. The last one was wrong. Dana slid the needle in at a shallow angle. The flash came back immediately, a thin thread of crimson in the catheter chamber. She advanced the cannula with one smooth motion, pulled the needle, connected the tubing. The drip started without resistance. Margaret looked at the IV, then at Dana. You're good at that. Thank you. The last nurse wasn't. The one before that wasn't either. You're the first one who looked at my hand before she grabbed my arm. Dana taped the site down and smoothed the edge of the dressing. Old habit. What kind of habit? The kind you build starting IVs on patients in moving helicopters, at altitude, in the dark. The kind that comes from practice, Dana said. She was collecting the sharps when she felt it, not heard, felt. A low vibration, deeper than the hospital's HVAC system, deeper than the traffic on Harbor Boulevard outside. It traveled through the floor, up through the soles of her shoes, into the bones of her ankles. It registered in her body before her brain processed it. Her hands stilled. She knew that frequency. Not helicopters, not this time. Something heavier. Engines that moved fast and deliberate, the kind attached to vehicles that did not stop for traffic lights. "You okay?" Margaret asked. Dana was already looking at the window. The frosted glass on the north wall of the ER faced the ambulance bay. The light through it had changed. There were shadows that hadn't been there a moment ago. Multiple shadows, moving fast and close together. "I'm fine," she said. Her hands had gone completely still. The radio at the charge desk crackled. Then it crackled again, louder, someone keying the mic hard and not releasing. "Harwick Coastal. This is Priority 1 transport inbound. ETA 60 seconds. Clear your primary trauma bay. This is a federal priority. I repeat, clear the bay." The charge nurse, a heavy-set man named Pete, stared at the radio for a full 3 seconds. "Federal?" he said to no one in particular. The voice didn't repeat itself. It didn't need to. Pete reached for the overhead PA. "Attention all ER staff, Trauma Bay 1, clear the bay immediately. We have a Priority 1 incoming. All personnel to your stations." The ER shifted. Not scrambled. The staff was too experienced to scramble. But shifted, the way weight redistributes on a deck when the sea changes direction. Carts moved. Nurses repositioned. Residents looked up from their tablets. Dana stood outside Bay 9 and did not move. She watched the ambulance bay doors. She counted. 50 seconds. 55. 60. The doors opened. Not ambulances. 3 black SUVs, tinted windows, no visible plates from this angle. They'd pulled up at angles that blocked the approach, a defensive formation she recognized from convoy procedures she'd been briefed on more times than she could count. The doors opened in sequence and men stepped out, civilians, on the surface. Khaki pants, dark jackets, clean shoes. But she saw what the clothes were hiding, the way they moved. The spacing they kept between each other, the way 2 of them immediately turned outward, scanning the perimeter of the ambulance bay before anyone reached into the vehicle. The way one of them had his right hand inside his jacket and kept it there. They were not civilians. The last man out of the rear SUV was different. Older, 60, maybe 65. He wore a suit without a tie, and he walked the way men who have held command for decades walked, not quickly, not urgently, but with a weight that made the space around him reorganize. She couldn't see rank, no uniform, but she felt it. The operators opened the back of the second SUV. The litter came out fast, 4 of them on it, 2 per side, moving with the coordinated efficiency of men who had done this before, in worse places, with fewer resources. Dana saw the patient at 30 feet, white male, mid-30s, barrel-chested, the build of someone who had maintained physical conditioning long after it stopped being required. His face was the color of old concrete. His lips had the bluish-gray tint of someone whose circulation was failing. He was conscious, his eyes were open, but his chest was moving wrong, short, labored, compensating. She knew what compensating looked like. Her feet took 2 steps toward the trauma bay before she caught herself. "Stop. You're a float nurse, you're nobody. Let the attending handle it." Dr. Lowe was already moving. He'd come from the physician workroom and was pulling on gloves as he walked, the kind of purposeful movement that looked more competent than it was. He met the litter in the corridor. "What have we got?" he said. One of the operators, big, close-cropped, dark hair, a scar along his left jaw, answered without breaking stride. "Operator down. Suspected penetrating chest trauma. He's been compensating for 22 minutes. Lowe looked at the patient, then at the operator. "What kind of trauma? Where's the entry wound?" "We can't tell you that." I need to know what I'm dealing with. You need to save him. The operator's voice was flat, not aggressive, just final. That's what you need to do. They pushed through the trauma bay doors. Dana followed at the edge. She stayed back against the wall, arms at her sides, watching. The team transferred the patient to the bay table with practiced efficiency. Leads were going on, monitors coming up. One of the ER nurses, a competent third-year named Jess, called out vitals as the numbers appeared. BP 78/50, heart rate 122. O2 sat 89 and dropping. Lowe was at the bedside with his stethoscope. He listened to the chest, moving the bell in the pattern Dana had watched him use before. Methodical. Textbook. The numbers on the monitor dipped. O2 sat dropped to 86. Get me a chest x-ray, Lowe said, and get portable ultrasound in here. The operator with the jaw scar stepped forward. Doctor, we don't have time for imaging. I need to know what I'm treating before I can treat it. His JVD is visible from here. His pressure is dropping and his heart sounds are distant. You know what that is. Lowe's jaw tightened. I'll make the clinical judgment. Dana's eyes moved to the patient's neck. The jugular veins were distended, visible above the clavicle even from across the room. She looked at his trachea, the midline reference, checked for deviation. Hard to confirm from this angle, but the patient was compensating with his head position. She looked at his face. Muffled heart sounds she couldn't confirm without a stethoscope, but 2 of Beck's 3 were visible to anyone who knew what to look for. Distended neck veins, hypotension, and Lowe had mentioned distant heart sounds himself, which meant he'd heard it and was still calling for imaging. Beck's triad, cardiac tamponade. There was blood in the pericardial sac, blood outside the heart, compressing it from the outside. The heart couldn't fill, couldn't pump. With every passing minute, the effusion expanded and the blood pressure dropped, and there was a point on that curve where no amount of intervention would bring a man back. She had watched a man die this way once, in a valley in Kunar province. She had watched him die because the helicopter was delayed, and the physician on scene had not had the training she had. She had been 24 years old. She had known exactly what was needed. She had not had the authority to do it. That man had a name. She still knew it. The monitor alarmed. Heart rate 130. Sat 84. Lowe ordered the portable ultrasound again. The tech was already moving, but the machine was in the corner, and it was going to take time to set up, and time was the one thing they did not have. The older man in the suit stepped through the trauma bay doors. He had not rushed. He moved to the side wall and stood there, watching with the stillness of someone accustomed to watching things unfold and deciding whether to intervene. His eyes moved across the room, across the team, across Dana, who was still against the far wall. He didn't linger on her, but he registered her. She could tell. The operator at the bedside, jaw scar, voice like gravel, looked at the suit man. Some communication passed between them that Dana couldn't hear. Then the suit man looked at the monitor, then at Lowe. Doctor, he said. His voice was the kind of voice that had given commands in rooms larger than this one with higher stakes. What is your assessment? Lowe was connecting the ultrasound probe. Working on it. We don't have time for working on it. What do you think it is? Lowe hesitated. Possible tension pneumo. Could be hemothorax. I want to confirm. His trachea isn't deviated, Dana said. The room went silent. She hadn't planned to say it. It came out the way reflex came out, faster than decision, older than 4 months of careful invisibility. Lowe turned to look at her. Excuse me? His trachea isn't deviated. She pushed off the wall, took 3 steps toward the bed. If it were a tension pneumo, you'd see tracheal shift. His JVD is bilateral. His pressure has been dropping for over 20 minutes with no change in respiratory effort. She looked at the monitor. It's not his lungs. It's his heart. Lowe stared at her. You're a float nurse. Beck's triad. 2 of the 3 are visible from here. You said the heart sounds were muffled yourself. She looked at him. Steady. Flat. It's a tamponade. The monitor alarmed again. Heart rate 140. Sat 82. Blood pressure 64/40. The operator with the jaw scar looked at the suit man. The suit man looked at Dana. Can you treat it? He said. And that was the question she had spent 4 years making sure no one would ever ask her. The room held its breath. Dana looked at the suit man, then at the patient, at the monitor reading 62/38, and the O2 saturation sliding toward 79. She looked at her hands. They were not shaking. Yes, she said. Lowe moved between her and the bed. You are out of your lane. This is an attending physician procedure. You do not. Then do it. She met his eyes. Right now. Sub-xiphoid approach, 18-gauge spinal needle, angled at 45 degrees toward the left shoulder. Do it, and I'll stand here and watch. Go. Lowe said nothing. 2 seconds. 3. The monitor alarmed continuously now. The sustained tone of a patient whose heart was trying to do something it could no longer do. Move, Dana said. She didn't push him. She didn't need to. She stepped around him with the certainty of someone who knows exactly where they are going, and that certainty made space. People moved. The way people move when someone who knows their destination enters a room where everyone else is still figuring out where to stand. Jess was already at the supply cabinet. She had heard the word procedure, and her hands were moving before her brain caught up. Dana looked at her. 18-gauge spinal needle, 10cc syringe, sterile drape, betadine. She pulled gloves from the box on the side rail, snapped them on in one practiced motion. And get me a hemostat. You're not authorized to, Lowe started. The man is going to die in the next 3 minutes. Dana looked at him once. One time, flat, final. You can file the paperwork afterward. Jess put the tray on the side rail. Dana looked at the patient. His eyes were still open, barely. The gray in his face had deepened. His breathing was shallow and wrong. The compensating effort of a man whose heart was being squeezed from the outside. Hey. She put her hand on his forearm. Firm. The kind of contact that communicated certainty. I've got you. Don't move. His eyes found her. Whatever he saw, it was enough. He stopped fighting. She tilted the head of the bed to 15 degrees, found the xiphoid process with her left hand, the small bony protrusion at the base of the sternum, and identified the subxiphoid notch. The narrow corridor between bone and heart, where, angled correctly, she could reach the pericardial sac without touching the myocardium. If she angled wrong, she would cause a cardiac puncture that would kill him faster than the tamponade. She had done this before. 3 times in the field. Once in Helmand Province on a British SAS operator, under fire, with a headlamp and no imaging. Once in Mosul on a ranger who had been down for 19 minutes. Once on an Air Force crew chief in a canyon where no imaging could have arrived in time. All 3 had lived. Nobody here knew that. Betadine, she said. Jess swabbed the entry site. The antiseptic smell rose clean and sharp. Dana picked up the spinal needle. 18-gauge, 3.5 inches. She attached the 10cc syringe and drew back the plunger slightly. Negative pressure maintained throughout, feeling for the change that would tell her she was in the right place. She placed the tip at the left border of the xiphoid process, angled toward the left shoulder at 45 degrees, breathed out. She advanced. Subcutaneous tissue first, then the slight shift in density as the needle crossed the pericardium's fibrous outer layer. The syringe filled. Dark blood, non-pulsatile, venous, the right color, the right consistency. Blood that had been sitting in the pericardial sac under pressure, not the bright arterial red of a punctured heart. She stopped advancing, drew back, 10 cc's. She detached the syringe without moving the needle, handed it to Jess, reattached an empty one. BP coming up, Jess said. 72/50. More blood. The effusion was substantial. Post-traumatic hemorrhage from a penetrating injury she still hadn't been told the location of. She attached the hemostat to the needle at the skin surface, clamped it to prevent migration, and held it steady. She drew twice more. 88/60, Jess said. Then, 92/64. The monitor tone changed. The alarm stopped. The room heard it. The sustained urgent alarm gave way to the rhythm of a heart that could fill again. A heart that had been strangled and was now breathing. The waveform organized itself back into something recognizable. A shape. A pattern. A pulse that meant a person was still in the body on the table. Heart rate dropped from 140 to 116, to 104, to 92. O2 sat climbed. 83, 87, 91. The patient's eyes had changed, from half-closed to open, from absent to present, looking at the ceiling with the expression of someone who had just come back from somewhere they hadn't expected to return from. Dana held the needle steady and kept her eyes on the monitor. 60 seconds, start to finish. The room didn't move for a moment after the alarm stopped. The particular stillness that follows something no one has words for. The stillness of people revising what they thought they knew. Lowe stood against the supply cabinet, 90 seconds without moving, gloves still on. The face of a man watching something his framework couldn't explain. Jess was looking at Dana's hands, just looking at them. The operator with the jaw scar stood at the foot of the bed with his arms at his sides. Not gratitude yet, something more immediate. Relief so large it hadn't become anything coherent. Dana checked the needle placement, checked the hemostat. Drainage had slowed, the acute effusion relieving, the heart decompressing. He would need imaging and surgical consult, the needle replaced with a proper indwelling catheter. But the immediate crisis had a different answer than it had 60 seconds ago. He wasn't dying anymore. She became aware of the man in the suit. He had not moved from the far side of the room. He had not spoken since asking if she could treat it. He had not looked at his phone or the monitor or the team. He had watched her, with the stillness of someone who missed nothing and was deciding what to do with what he'd seen. She kept her eyes on the patient. "He needs CT of the chest as soon as he's stable enough to move," she said. "Cardiothoracic surgery in this room in the next 10 minutes. The needle needs replacing with an indwelling catheter if the effusion reaccumulates." She looked at Jess. "Get CT on the phone. Post-traumatic cardiac tamponade, decompressed, awaiting surgical consult." Those exact words. "Got it." Jess was already moving. Dana looked at the patient. His color had shifted, not good yet, but no longer concrete gray. His eyes were tracking. He looked at her with the expression of a man trying to process too many things at once. "You're going to be okay," she said, not gently. "Status report." He heard the difference. His jaw set. His chest moved in a steadier rhythm. "Thank you," he said, rough and compromised, but his. Dana stepped back from the bed, and then she made the mistake of looking toward the far side of the room. The man in the suit was watching her, the eyes of someone who had spent decades reading people in high-pressure environments, not suspicious, not accusing, just recording everything with precision that missed nothing. Tall. Built like someone who maintained conditioning long past when most men stopped. Hair steel gray, cut close. No uniform, no insignia visible. But she had spent 10 years around men who wore rank. She could read what wasn't visible as clearly as what was. 3 stars. At minimum. He walked toward her. Dana did not move. She peeled off her gloves and dropped them in the waste bin. She picked up the documentation sheet and clicked her pen. He stopped 6 feet away. The room moved behind him. Jess on the phone, operators staying close to their man. A resident waved back from the doorway. In the space between Dana and the suit man, there was silence. "Where did you learn that?" he said. Low. Direct. The voice of someone who already suspected the answer and was offering her the chance to provide it before he went and found it another way. Dana looked at her documentation sheet. Nursing school covers emergent pericardiocentesis in critical care curriculum. No, he said. It doesn't. She wrote the time. 11:58. Not like that, he continued. Not without imaging, without ultrasound guidance, without attending authorization, and without 1 second of hesitation. That technique. The angle, the negative pressure maintained through the entire insertion, the hemostat clamp at the skin surface. That's a specific protocol. A very specific one. Dana did not look up. I read extensively. I'm sure you do. She wrote the approach. Subxiphoid. Angle. 45 degrees toward left shoulder. Gauge. 18G spinal. Who are you? He said. She looked at him then, directly. His face told her nothing, which told her everything. Only people with a great deal of practice controlled their faces that completely. Dana Reeves, she said. Float nurse, Coastal Staffing Agency. She looked at the patient. Your man needs that surgical consult. Pressure is holding, but catheter placement needs imaging confirmation when he's stable. The man in the suit held her gaze 3 seconds longer than comfortable. Then he took out his phone, turned slightly, and placed a call. She couldn't hear the words. She didn't need to. She knew the shape of that call. Brief, precise. Routed through channels most civilians didn't know existed. She had made those calls herself, from satellite phones in places with no signal, calling in a status on an operator who had been recovered and was stable and whose identity needed to be confirmed. She turned to the sink and washed her hands. The water ran over her forearms. The burn scar on her left forearm caught the light, a pale, defined stripe running 4 inches toward the elbow. Deep damage, the kind that healed the way skin healed when the conditions for healing had not been ideal. She turned off the water. Dr. Lowe was 3 feet behind her, arms crossed. Face holding the expression of a man whose certainty about how the world works has just been interrupted by something the world wasn't supposed to be able to do. You are going to explain, he said quietly. Exactly what just happened. Dana dried her hands. I performed an emergent pericardiocentesis on a patient with Beck's triad who would have arrested in the next 2 to 3 minutes without intervention. You are not authorized to perform that procedure. He's alive. She folded the paper towel. I'll take the write-up. Lowe's jaw worked. That procedure can kill a patient if done incorrectly. I know. She met his eyes. That's why it should be done correctly. She dropped the towel in the waste bin. The first time I performed it, I was at 9,000 feet in Helmand Province. I didn't have a supply tray. I used what I could reach and improvised the rest. A pause. He lived too. She walked back toward the trauma bay. Behind her, she heard Lowe say her name to someone else. Pete at the charge desk. She heard him pick up a phone. She didn't look back. The man in the suit was still on his call, turned to the far corner. She could see the set of his shoulders, the posture of someone fitting new information against what he already knew, arriving at a specific destination. He lowered the phone. Their eyes met across the trauma bay. He held the phone away from his ear. Master Sergeant, he said. Not a question. Dana did not confirm it. She held the Admiral's gaze for 3 seconds. Then she looked at the documentation sheet still in her hand and clicked her pen. Reeves, she said. Dana Reeves, float nurse. The man in the suit watched her write the words. He let the silence sit for a moment, the way men who are accustomed to receiving information let silences sit. Not uncomfortable, just present. Rear Admiral Marcus Thorne, he said. Naval Special Warfare Command. He didn't extend a hand. The call I just made was to AFSOC, Air Force Special Operations Command. They pulled a file for me. He paused. Took them about 90 seconds. Dana kept her eyes on the paper. Date. Attending nurse signature line. She wrote her name. Your full legal name is Dana Elizabeth Reeves, Thorne continued. His voice was even, almost conversational. You enlisted in the Air Force at 19, selected for PJ training at 21, completed INDOC, passed, airborne, combat dive, SERI, and paramedic certification within 18 months. Served 10 years, deployed to Afghanistan twice, Iraq once, and one other location that isn't in the file I was given access to. He paused. You were medically separated at 29 as a master sergeant with a Purple Heart, a Bronze Star with Valor device, and a commendation I'm told is classified to a clearance level I don't technically need to know about. He tilted his head slightly. You've been working civilian nursing contracts for 4 years under your legal name, which isn't a maiden name, just a name. Dana finished signing the document. How am I doing? Thorne said. You have good researchers. She set the pen down. Your man needs that CT. The drainage is holding, but the effusion may reaccumulate if there's ongoing hemorrhage. I know. He didn't move. He'll get his CT. I need 60 more seconds of your time. You can have the 60 seconds while I walk him to radiology. Thorne almost smiled. It wasn't quite a smile. It was the expression of someone recognizing a quality they'd spent a long time looking for. All right. Dana walked to the patient's bedside. The seal, his name tape had fallen away in the transport and nobody had replaced it, was more alert now, color returning in irregular patches to his face, the circulatory improvement working its way through from his core, outward. His eyes tracked to her the moment she appeared in his line of sight. She checked the hemostat, checked the line, checked his vitals on the monitor. 94/62, heart rate 88, O2 sat 93. Still with me? She said. Rains, he said. His voice was sandpaper, low and rough. Senior Chief Petty Officer, Rains. Good, Rains. I've got you. His hand came up and found her wrist. Not grabbing. He didn't have the strength to grab, just resting, like an anchor. I know you, he said. Dana didn't look at him. She kept her eyes on the monitor. You're on a lot of medication. Not that much. His grip, weak as it was, didn't release. Rook. The word landed in the room like something dropped from a height. Behind her, she heard the chief with the jaw scar go very still. She could feel it, the quality of stillness that isn't the absence of movement, but the presence of extreme attention. You're confused, Dana said. Quiet, flat. Rains looked at her. His eyes, despite everything, were clear. You pulled me out of a riverbed in the Korangal. You went in alone. Your team was pinned. He paused to breathe. I was 19 minutes down. You told me the weather was better in Colorado. Another breath. You were not kidding about that. The room was very quiet. Dana said nothing. Chief Dawson, the operator with the jaw scar, took one step forward. He was looking at her the way you looked at something you'd heard about for years and suddenly recognized. You're Rook, he said. Not a question, a confirmation. I'm a float nurse, Dana said. You're Para-Rescue Master Sergeant Dana Reeves, call sign Rook, PJ Team Leader, 24th Special Tactics Squadron, Bagram 2016 through 2019. Chief Dawson's voice had lost its tactical edge. What was left underneath it was something closer to reverence, which was not an expression that belonged on a face like his and looked almost wrong. You saved 8 operators in Kunar in 2018 during the Sayar Valley operation. You went back in 3 times. You took a round through the thigh on the 3rd run. He paused. The Ranger Battalion commander put you in for the Medal of Honor. The recommendation was downgraded, Dana said. I know. I was there. The words hit her between the ribs. She turned to look at him, looked at his face. The jaw scar, the particular arrangement of his features, older now, worn differently than she remembered, but there. Dawson, she said. Yeah. His jaw tightened. You carried me 200 meters under fire. I had a femoral bleed and a punctured lung, and you carried me 200 meters. He exhaled. Then you came back for Martinez. Dana's hands were very still. The trauma bay had the quality of a room where people had stopped pretending to be busy with other things. Jess was standing near the supply cabinet with a saline bag in her hand that she had forgotten she was holding. The resident in the doorway had not moved in several minutes. Even Pete at the charge desk, visible through the window, had stopped typing. Thorne stood at the edge of the bay and said nothing. He was watching with the expression of a man who had suspected something and was now having it confirmed in a way more complete than he had anticipated. The double doors to the ER swung open. The woman who walked through them was wearing a blazer and the expression of someone who had been interrupted in the middle of something important and was very unhappy about it. Behind her came Pete, looking apologetic, and 2 hospital security guards. "Director Hess," Pete said. "This is the situation I described. I can see the situation." Director Carol Hess looked at the room. At the armed men she didn't have a category for. At Thorne in his suit, at Rains on the table with medical equipment attached to him, and then at Dana standing at the bedside. Her eyes moved to Lowe, who had not left the room. Dr. Lowe. "This nurse," Lowe said, "performed an invasive cardiac procedure without authorization, without physician oversight, and in direct violation of her scope of practice. I want her removed from this facility, and I want hospital legal on the phone." Hess looked at Dana with the careful expression of someone choosing the path of least resistance. "Nurse Reeves, I'm going to have to ask you to step outside with security while we sort this." "She stays." Thorne's voice was not loud. It didn't need to be. Hess turned to look at him. "I'm sorry, who are—" "Rear Admiral Marcus Thorne, Naval Special Warfare Command." He didn't raise his voice. He didn't need to do that either. "The patient on that table is a federal operator on an active classified deployment. This facility became a federal medical asset the moment my team brought him through your door under Federal Emergency Medical Authority, which supersedes your hospital's standard operating procedures and your attending physician's scope of practice objections." He looked at Hess with the calm of someone who had made pronouncements like this in far less comfortable settings. "The nurse stays. Your security personnel can wait outside." Hess blinked. "You can't simply declare—" "The paperwork is already filed. You'll have a copy within the hour." Thorne glanced at the security guards. "Thank you for your time." The guards looked at Hess. Hess looked at the guards. Then she looked at Thorne and made the calculation that people make when they understand they have no viable moves. "This isn't over," she said, to whom was unclear. "No," Thorne agreed, "it isn't." Hess walked out. The security guards followed. Pete stayed, uncertain where he was supposed to be, and eventually drifted back toward the charge desk. Lowe had not moved. His arms were still crossed. His face had moved through several expressions in the last 2 minutes and had arrived at something that looked like a man standing at the edge of something he couldn't step back from. "She is not qualified," he said. To Thorne, whatever her background, whatever her history, she is not a physician. She performed a procedure that could have killed. It didn't. Thorne looked at the monitor. 96/68, heart rate 84. He looked at Lowe. "Because she performed it correctly. That is not the point. It's the only point that matters in a trauma bay, doctor." Thorne's voice was still even, still without heat. "The point is whether your patient is alive. He is. Ask yourself why." Lowe's jaw worked. Dana said nothing. She checked Rains's hemostat one more time and looked at Jess. "CT is ready?" "Ready and waiting," Jess said. "Let's move him." They moved Rains to CT at 12:17. Dana walked with the gurney, one hand resting on the side rail, monitoring the needle placement through the corridor. Thorne walked alongside her. Dawson and one other operator flanked the rear. The hospital corridor was the kind of corridor that looked the same at noon as it did at midnight. Fluorescent, relentless, the particular institutional light that didn't flatter anyone. Dana had spent enough time in corridors like this to stop seeing them. She saw them today. She saw the residents who stopped talking when the group went past. The orderly who pressed against the wall to let them through. The charge nurse from the 3rd floor who leaned out of a doorway and then leaned back in. "You disappeared," Thorne said, not accusatory, factual. I separated. You separated and then you disappeared. There's a difference. He kept pace with the gurney. Medical separation under honorable conditions, full benefits, access to VA services, and then 4 years of civilian nursing contracts, never in the same city for more than 6 months. Until here. Dana looked ahead. I like the coast. You have a PTSD management plan on file with a VA therapist you stopped seeing 14 months ago. She didn't answer. I'm not saying that to embarrass you, Thorne said. I'm saying it because I've read your file and I want you to know I've read it. The whole thing, not the redacted version. The gurney wheel squeaked on a linoleum seam. Dana adjusted her grip on the side rail. The Sayar Valley operation, Thorne said. 2018. The after-action report lists 7 survivors. Your own report listed 8. There was a discrepancy in the initial count. The discrepancy was a SEAL lieutenant named Marcus Raines, who was not on the original extraction manifest because he'd been separated from his element during the initial contact and wasn't confirmed as a casualty until you found him. Thorne's voice remained even. You found him 19 minutes into his exsanguination. The medical consensus at the time was that nobody survives a femoral arterial bleed past 12 minutes without intervention. The consensus was wrong. Because of you. Thorne looked at her. You've been saving people who weren't supposed to survive for 10 years, Master Sergeant, in conditions that would have broken most physicians, let alone most paramedics. You did it because that's who you are. And then 2 of your teammates died on an extraction that went sideways, and you decided that person, the one who saved people who weren't supposed to survive, was too dangerous to be anymore. Dana's throat tightened. She didn't answer. They reached the CT suite. The tech was waiting, a young man in his 20s, who looked at the group arriving and made a rapid recalibration of what kind of day he was having. Dana gave him the clinical summary. He nodded and began positioning the machine. Raines looked up at her from the gurney. His color had continued to improve. He was fighting the sedation. She could see it in the tension around his eyes, the deliberate effort to stay present. You didn't have to come back in, he said. I was already in. I mean the second time. In the Korangal. His voice was still rough but steadier. You got me out. Your team was extracted. You came back in alone for Martinez. Dana checked the hemostat one last time. He was alive. He was barely alive. Barely alive is alive. She looked at him. Hold still for the CT. Don't move your torso. Raines looked at her for a moment with the expression of someone who had something else to say and understood this was not the moment to say it. He settled back. Thorne moved to stand beside Dana while the CT began. They stood in the observation corridor, watching through the glass as the machine began its rotations. Why Harwick? He said. Specifically. Dana watched the scan. A friend told me about it. Quiet posting, near the water. You knew there was a SEAL team operating out of this area. She said nothing. Not looking for them, Thorne said. Just knowing they were there, close enough if something happened. The machine hummed. The images began building on the screen. Cross-sections of a chest, the pericardial space, the catheter in position. The effusion smaller now than it had been at arrival. You couldn't stop being who you are, Thorne said. You just moved somewhere where who you are could be useful without being visible. He paused. That's not retirement. That's a different kind of service. Dana's jaw tightened. I'm a nurse. Yes, a nurse who just performed a field pericardiocentesis with the technique angle and clinical judgment of a 10-year pararescue master sergeant in the middle of a civilian ER. Thorne looked at her. The two aren't mutually exclusive. The CT tech appeared in the doorway. Images are ready. The effusion is significantly reduced. Cardiothoracic surgery is scrubbing in now. Thank you. Dana looked at the images. The pericardial space was clear of significant fluid. The catheter placement was correct. She had known it was correct, but seeing it confirmed was its own separate thing. He'll need the OR to address the source. There's a high-velocity penetrating injury to the pericardium itself, The effusion will reaccumulate without surgical repair. The tech nodded and went back in. Thorne looked at the images. You can read CT scans. PJs are trained in advanced radiology interpretation. Most civilian nurses aren't. No. Dana turned away from the glass. They aren't. She walked back toward the ER. Thorne walked with her. Dawson fell in behind them, silent, carrying the weight of someone who had said what he needed to say and was now waiting for the next thing. At the junction of the corridor, the split between CT and the main ER, Dana stopped. She turned and faced Thorne directly for the first time since he'd said the words, Master Sergeant. Her hands were at her sides. Her spine was straight. Not the deliberate curve she'd spent 4 months maintaining, the posture of a person trying to take up less space. Just straight, her own. What do you want? She said. Thorne looked at her. Right now? For you to go back into that ER and finish your shift? And after that? That's a conversation for when your patient is out of surgery and you've had a chance to sit down. He paused. But I'll tell you this much. The Naval Special Warfare Medical Training Program has been trying to develop a civilian trauma integration curriculum for 2 years, teaching operators how to function in civilian medical environments and teaching civilian medical staff how to support operators in crisis situations. The person running that program needs combat medical experience, civilian medical experience, and the ability to work in both worlds without compromising either. He held her gaze. I've been looking for that person for 14 months. Dana was quiet. I'm not asking you to go back into service, Thorne said. I'm asking you to consider that what you are right now, both things at the same time, might be exactly what's needed. He turned and walked back toward CT to wait for Raines's surgical transfer. Dana stood in the corridor. Then she turned and walked back into the ER. Lowe was at the charge desk when she came through the doors. He had a phone to his ear, and his back was partially turned. He saw her come in. He said something into the phone and ended the call. He put himself in her path. Not blocking. The corridor was wide enough to go around him, but in her path, with the deliberate presence of someone who had decided this was the moment. I've spoken to the medical board, he said, and to our malpractice carrier. His voice was low, controlled. The voice of a man reorganizing around a new approach. Whatever the Admiral says about federal authority, the fact remains that you performed an invasive cardiac procedure outside your scope of practice. That's a licensing matter. The federal authority piece doesn't reach into state licensing. Dana stopped. She looked at him. 4 months of not looking at him. Looking past him, through him, at whatever was slightly to his left. The particular avoidance of someone who understood that direct eye contact with men like this was an escalation they would use. Not now. You heard Beck's triad, she said. Before I said anything, you heard the muffled heart sounds and you called for imaging. Lowe's jaw tightened. I was gathering information to... You were stalling. Dana's voice was the same volume it had been all day, quiet even. But the evenness had changed. Not because you didn't know what it was, because you knew what it was, and you didn't know how to treat it. And you didn't want to say that in front of your residents, in front of the operators, in front of anyone. She paused. So you ordered imaging, because imaging buys time, and time was the one thing that patient didn't have. Lowe's face reddened. You don't know what I was thinking. I know what I saw. I've stood in enough trauma bays to know the difference between a physician gathering information and a physician managing his own uncertainty. She held his gaze. The procedure I performed is in the TCCC manual. It's in the ATLS guidelines. It's been documented and practiced by military medical personnel for 25 years. It saved that man's life. You can file whatever you want with whoever you want. She paused. But when the medical board asks who saved the federal operator and who was ordering a portable ultrasound while he was dying, both answers are going to be in that chart. Lowe stared at her. For a long moment, neither moved. You're still just a nurse, he said. The words came out smaller than he intended. the diminishment aimed at her landing back on him instead. "Yes," Dana said. "I am." She stepped around him and went back to work. The afternoon moved the way afternoons in an ER moved, relentlessly, without regard for what had happened that morning. A construction worker with a hand laceration, an elderly man with a hip fracture, a child with a fever that turned out to be an ear infection. The usual tragedies and near misses and things that resolved with sutures and antibiotics, and someone squeezing a small hand and saying it was going to be okay. Dana moved through it all. Jess was at the supply station when Dana came through for fresh gloves at 2:15. She looked at Dana with the expression of someone trying to figure out how to ask something. "You can ask," Dana said. "Is it true?" What Dawson said. Sayar Valley, going in alone. The team was pinned. Someone had to go. You went in 3 times. Third time was for a SEAL named Martinez. He hadn't been confirmed as a casualty. He was. Dana picked up the chart for Bay 4. But he was alive when I got to him and alive when I got him out. She paused. The math worked. Jess was quiet. "Why are you here? After all that, why are you here doing this?" Dana looked at the chart. "Because people need nurses. In ERs, in trauma bays, in small hospitals on the coast. The address changes. The work doesn't." Jess nodded. She understood that this was the answer, and that it was complete. At 3:40, Pete called from the charge desk. "Reeves, the Admiral's asking for you." She found Thorne in the family consultation room at the end of the corridor, the small room with the tissue box and chairs arranged in a circle that never quite worked. Dawson stood near the door. A tablet sat on the table. Rains was out of surgery. Thorne said that first. Cardiothoracic had repaired the pericardial laceration, placed a surgical drain. He was in the ICU. He was going to live. She sat down. Thorne slid the tablet across. Her name at the top, her full name, her rank. A service record summary she hadn't read since the day she signed her separation papers. Operations listed by classification code. She knew each one. The citations. The Kunar province incident. A man with a broken femoral artery who survived because she had refused to do the calculation that said he shouldn't. The last entry was dated 4 years ago. Below it, someone had typed today's date. Action at Harwick Coastal Medical Center, 12 hours. Outcome: 1 operator preserved. "I need your decision," Thorne said. "Not today, not this minute, but before we leave." He paused. "I can close this file. Let you go back to being Dana Reeves, float nurse. The hospital's legal matter gets handled through channels that leave you untouched. You walk away the same way you walked in. Or," Dana said, "or I open it back up. Consulting position with NS Stauber's medical training. Nursing license stays current, civilian status intact. You work in both worlds, which is what you've been doing without calling it that." He looked at her. "Either way, you keep your name, your life. I'm not here to drag you back to anything you walked away from." Dana looked at the tablet. Today's date. 1 operator preserved. She thought about a riverbed in Kunar province. 19 minutes of irreversible time already behind her and the decision to do the next thing anyway. She thought about Margaret in Bay 6. Fragile veins, unfed cat, the look on her face when the IV went in right. "1 condition," she said. Thorne waited. "I stay at Harwick Coastal. The consulting fits around my shifts, not the other way around." She set the tablet down. "And I stop floating." His expression shifted, the recognition she'd seen in the corridor. "You want a permanent position? This hospital needs a trauma nurse who knows what she's doing." She looked at him. "Director Hess will have a problem with that." "Director Hess has several problems today that don't involve you. The federal authority declaration I filed this morning triggered a compliance review. The team arrives Thursday." He paused. "She'll be focused elsewhere." "Low? The chart from this morning is a complete medical record. What he ordered, what the monitor documented, what you did and when you did it. Anyone who reads it carefully understands exactly what happened. He stood. Some consequences don't need to be administered. They're already in the record. He extended his hand. She shook it. Brief, firm. A transaction that meant something. Dawson caught her eye from the door. He nodded once, the nod that carried a full sentence. Acknowledgement, respect, and something he would have been embarrassed to say out loud. She returned it. Then she walked back into the ER. The department was shifting toward evening. Day nurses handing off to nights. The fluorescent lights unchanged, as they were always unchanged, indifferent to the hour. The ER didn't have windows that mattered. Sofia Martinez was at the workstation finishing her end-of-shift notes. She looked up when Dana passed. Something in her face had shifted since morning, the particular recalibration of watching something happen and understanding what was possible. Dr. Lowe went home, she said. Left at 3. Dana nodded. For what it's worth. Martinez paused, choosing words carefully. What you said to him after? I've been in this program 2 years. I've never seen anyone say the right thing to someone who wasn't going to like it and not flinch. Dana looked at her, the second-year resident who had a clean presentation style and good instincts, and had been interrupted twice that morning by a man who believed interruption was education. It gets easier, Dana said. Does it? No. Almost a smile. But you stop minding that it's hard. She went to the supply closet and began restocking. Gauze packs, catheter kits, IV supplies, the work of hands that knew where things went. Her phone buzzed, unknown number. Master Sergeant Reeves. Raines's voice, rough with sedation, but present. They gave me 5 minutes. You should be sleeping. I'll sleep in a minute. A careful breath. I've been thinking about what to say to you for 3 years, since I found out you were the one who came back. You don't have to say anything. I know. I want to. His voice steadied. I want to say I owe you something I can't pay back, and I know it, and that I'm glad you were here. Not as Rook, just here. Because without you, I would have died on that table, and that would have been the second time you were the difference. I think that means something. Dana stood in the supply closet with her hand on a shelf. Get some sleep, Senior Chief, she said. Yes, ma'am. A pause. Rook. Reeves, she said. A short silence. Reeves, he agreed. She put the phone down, stood for a moment in the cool of the supply room, the ordered rows of things that kept people alive in ordinary moments and extraordinary ones, the antiseptic smell, the specific quiet of a room that held its temperature against the rest of the hospital. She had learned this closet the way she'd learned every post, thoroughly, as though she intended to stay. She had intended to stay. Not because she was trapped, not because she was hiding, because staying, done right, was its own kind of mission. She'd been a ghost here for 4 months, restocking shelves, covering lunch breaks, being handed the assignments nobody wanted, and completing them without complaint, and going home and starting again the next morning. And she had told herself that was enough, that the quiet competence was a kind of service, anonymous and undangerous, and far from the world that had cost her too much. But anonymous hadn't saved Raines. Training had. Experience had. 10 years of going into impossible situations and choosing to do the next thing anyway. That had saved him. She couldn't leave that at the door just because the door was a civilian one. She picked up the gauze and finished the shelf. The ER was full when she came out. New shift, new faces. The evening presenting its particular cases. A domestic accident, a teenager's sports injury, a woman with blood pressure that needed watching. The department breathed and moved and processed. Dana walked to the charge desk. Pete was logging off. You're supposed to be off at 7, he said. Bay 4's been waiting 40 minutes. She picked up the chart. He looked at her for a moment, the look of someone trying to place who they were talking to. Then he seemed to decide the answer was enough. Night, Reeves, he said. Night. She walked toward Bay 4. Behind her, the ER continued. Monitors beeped. A wheel squeaked on linoleum. Somewhere in the unit, a child cried and then stopped. The fluorescent lights hummed their relentless, indifferent hum. The smell of antiseptic and salt air, both at once, the way they always were. The same ER she had walked into at 7 that morning, invisible by design. She walked through it now with her spine straight and her hands still, and her badge clipped where it was supposed to be. Not a ghost, not a secret, a nurse. Her own. There was a lesson in this room, though it hadn't been the lesson anyone came here expecting to learn. Not about the woman with the hidden history or the Admiral with the sealed file or the procedure that couldn't be explained. Something simpler, harder to hold. Hiding what you are doesn't protect you. It costs you, quietly, every day, until the cost is so familiar you stop noticing it. Then one day something walks through the door that you can't let die, and your hands remember what your mind has been trying to forget. And you understand that the thing you've been running from is the only thing you actually were. You can be more than one thing. You can come from fire and choose quiet. You can carry a past that weighs more than most people's entire lives and still show up at 7 in the morning for someone else's ordinary emergency. The weight doesn't disappear, but it doesn't have to stop you. Dana Reeves walked into Bay 4, chart in hand, and introduced herself to the patient. "I'm your nurse," she said. And that was true, and so was everything else. The end. If this story stayed with you, hit that like button and leave a comment below. I want to know what part hit hardest. Share this with someone who needs to hear it today. Subscribe to Silent Badge's Stories for more stories about the people who carry more than anyone knows and choose to show up anyway.